Hello, my name is Dr. Justin Bice and I am Programme Lead for Intercalation here at the University of Leicester. This is a short presentation providing you with an overview of some of the opportunities available at Leicester University for students that may wish to intercalate during their medical studies. So what is intercalation and who is it for? Intercalated degree programs are specifically designed for medical, veterinary and dental students who wish to study for an additional qualification partway through their undergraduate degree. Intercalation is an opportunity for most medical students, provided that they have performed satisfactorily in their previous years of study. Students have the opportunity to gain an additional bachelor's or master's degree depending on at which point during their medical studies they choose to intercalate. So why choose to intercalate? Intercalation allows you the time to take a break from your medical studies. As you can imagine, the undergraduate medical degree is both demanding yet rewarding. It requires you to study a large breadth of medical sciences, from anatomy to physiology, from the cardiovascular system to infection and immunity. Intercalation provides you with the opportunity to take some time to explore and study a discipline in much more detail that interests you. It allows you to be more inquisitive, ask and answer questions about something that really interests you. You will have the opportunity to work with leading scientists and clinicians across the university and the University Hospital's Leicester NHS Trust. By working with these world-leading scientists and clinicians, you have the possibility to contribute to the innovation of medical science. So what could you achieve during an intercalating year? As I suggested on the previous slide, you will have the opportunity to take the time to really study a health-related subject that's important to you. This may be a subject that you've always been interested in, that you think may contribute to your possible career choice. It may be an area of medical science that you've really learnt to love during your previous undergraduate studies. During your intercalated degree, you will produce a large body of work. This work will be presented locally to your peers and colleagues. You may also have the opportunity to present your work nationally and internationally. In recent years, our intercalating students have presented across Europe, and last year several of our students presented in the United States of America at their discipline-specific international conferences. The work you produce during your intercalated year may also contribute to the publication of peer-reviewed medical and scientific papers. Science is all about collaboration, and during your intercalated year, you will have the opportunity to collaborate locally with colleagues at the university, nationally, and even internationally. These collaborations will prove invaluable in your future careers. So what are the specific career advantages of intercalating? Completing an intercalated year affords you an additional qualification. This may be a Bachelor of Science or Master of Science degree. As I mentioned on the previous slide, you may have the opportunity to publish your work in a peer-reviewed scientific or medical journal. All intercalated degrees will provide you with additional transferable skills that will benefit you during your foundation training. Completing an additional degree and possibly peer-reviewed publications that may come from this are seen favourably when you're applying for many specialty training programs early on in your careers. Higher Education England also note that the additional skills that you develop during an intercalated degree help you to become well-rounded and mature and excellently prepared for the workplace. An intercalated degree is also excellent preparation if you are one of the increasing number of doctors who want to conduct some research during their careers. It also provides you with a fantastic stepping stone if you are considering additional research degrees, whether that is a medical doctorate or a PhD. So when a student's able to intercalate, there are several possibilities. Medical students can intercalate after their second year of their undergraduate medical studies and can be awarded with a Bachelor of Sciences degree. They can wait and intercalate after their third year of their undergraduate studies and may be awarded with a Bachelor of Science or a Master of Science or possibly a Master of Arts degree. Similarly, if you wait until after your fourth year of your undergraduate medical studies, you may also be awarded a Bachelor of Science, a Master of Science, or a Masters of Arts degree. This will all depend on which course you choose to study. Similarly, when you choose to intercalate may also be dictated to by the course that you're interested in, and also other personal circumstances, and when you choose it may be best or most appropriate for you to take some time out of your medical studies to do an intercalated degree. Leicester Medical School will ensure that all students will be supported both while they're intercalating and ensure that they are well supported when they transition back into completing their undergraduate medical degree. So on the next couple of slides is some information about the current intercalating options at Leicester University. The first option available to students after their second year is a BSc in Biomedical Sciences. You will join the third year of one of the University of Leicester Biological Sciences degrees, and you will have the opportunity to select a number of modules that you will conduct alongside other third year students. You will also have the opportunity to complete a short analytical project towards the end of the year. The second option is an intercalated Bachelor of Science in Psychology. This is a bespoke course designed specifically for medical students choosing to intercalate. You will study a number of areas of psychology, including the biological basis of behavior, mental health, personality, clinical syndromes in adult and childcare, and also positive well-being. You will also have the opportunity to conduct a short dissertation during the year. The third option is probably our most popular intercalated option, and that's the Intercalated Master of Science in Medical Research, which is available to students after their third or fourth years. This again is a bespoke degree designed specifically for medical students choosing to intercalate. You will study a number of taught modules at the beginning of the year, covering different areas of basic science and clinical medicine, including quantitative and qualitative research. The majority of the year is focused on an extended research project, where you will have the opportunity to work either in one of the research labs at the University of Leicester or with clinicians at one of the university hospitals. Another option after the third or fourth year is an intercalated MSc in Quality, Safety and Healthcare. This is delivered by the Department of Health Sciences. During this year, you will have the opportunity to study patient safety, measuring and monitoring in healthcare, and have the opportunity to work alongside working healthcare professionals from the UK and other countries. The next option is an intercalated MSc in Healthcare Management. This degree is delivered between the Department of Health Sciences and the School of Business, and provides you with the opportunity to study several modules, including organizational behavior, business economics, managing professionals in healthcare, strategic management, and several options around foundations of leadership. The next option is another Master of Science degree in Geographical Information Science. This is delivered in another college in the School of Geography, Geology and Environment, and focuses on large data and environmental science. You will have the opportunity to study modules in geophysical data analytics, geophysical data and information retrieval, and environmental science. Another course which we plan to start during the year 2020-2021 is an intercalated MSc in Clinical Education. This will be delivered here in the Leicester Medical School, using our extensive pedagogical and medical education expertise to deliver a bespoke medical education Master of Science degree. You will consider educational theory, assessment in medical education, and also have the opportunity to conduct an extensive pedagogical research project. The final option we have currently is an intercalated MSc or intercalated MA in medical ethics and law. Again, this is due to start in the year 2020-2021. This again is shared between the School of Medicine and the University of Leicester School of Law, and provides you with the opportunity to select modules in jurisprudence and many areas of healthcare ethics. You will also have the opportunity to write an extensive project on a particular area of ethics or law that interests you. You also have the opportunity to intercalate at other institutions, and we are always reviewing our intercalation portfolio and considering additional options to offer our medical students. There are many generic and transferable skills that you will undoubtedly develop during an intercalated degree. I've included some of them below. I think one of the most important is the ability to critique and evaluate evidence. Almost all of the intercalating options available here at Leicester require you to produce an extended piece of writing or work on a research project. You may be collecting your own data in a laboratory or in a hospital setting, or reading about the data collected by others. The ability to contextualize this and present it to others is an essential skill for you to develop. Managing your own project is another that I've included. The undergraduate medical curriculum is quite prescriptive, involving you turning up at regular times to study particular topics that are decided for you. During an intercalated degree, especially during the project elements, you will be required to manage your own time, what you do when to turn up, and what to do when you do turn up. This is a skill that you will develop over this time and will be essential going into your clinical years and into your profession. Learning how to communicate science is a really important skill to develop. In almost all of the intercalated options we have available at Leicester, you will be able to work on this skill specifically with particular tasks relating to this. This again is an essential skill that you will need to develop for when you're out in practice. The ability to consider science, a medical report, and then present it to a patient in a clear and concise manner is really important. You will also have the opportunity to work on your oral and written presentation skills, presenting to other colleagues, and as I suggested in previous slides, possibly presenting to larger audiences, both locally and nationally. Something else I mentioned on a previous slide is the ability to enhance your professional development, and specifically networking. You will have the opportunity to work alongside colleagues that you already know, new colleagues and academics across the university and in clinical settings, developing this network that you will be able to build on in your clinical years and in your practice when you are qualified. On this slide, I wanted to include a few examples of some of the research projects that recent intercalating students have conducted. As I've mentioned in previous slide, these projects are supervised by leading scientists and clinicians, both from the university and the local hospitals. Students get to pick from an extensive range of projects. This year we had over 100 projects for students to choose from. A student in a recent project worked on drug discovery in the Department of Virology, considering the development of vaccination. We've had students working with our oncologists, considering radiotherapy and the pain that's associated with breast cancer. In the Department of Health, we've had students working on qualitative projects, ethnographic methods in healthcare improvement. In our excellent cardiovascular group here on university campus, we had a student working on fitness indices in cardiovascular disease. And we've also recently had a student working with gynecologists and obstetricians down at the university hospital, considering ultrasound in patients with diabetes. Every year we put a call out to clinicians and scientists to propose new projects, so every year students have the opportunity to contribute to cutting-edge science. If you would like further information about intercalating at Leicester University, then please email intercalation@le.ac.uk. You can also go to the university web pages specifically dedicated to intercalation, where you will find more information on each of the intercalating options we currently have at Leicester University. Thank you very much.